If you are over 60, certain sleep habits may be more dangerous than they look.
I'm Dr. Eleanor Hart. Let me tell you about Janet. Oh, Janet.
Janet kept getting a strange pattern. Her blood pressure looked worse in the morning.
She assumed it was stress, or age, or maybe just a bad week. But as a doctor, I have seen this many times. And the problem is often not just what happens during the day.
Many older adults have sleep habits that quietly push blood pressure in the wrong direction.
While they are supposed to be resting. And most of them have no idea it is happening. Stay with me, because one of these habits is so common. People mistake it for a normal bedtime routine.
Habit number 1. Using alcohol to fall asleep.
A lot of people say it helps me relax.
And yes, alcohol can make you feel sleepy at first.
But later in the night, it often leads to lighter sleep. More wake-ups, faster heart rate, and poorer recovery. That can place more strain on the body.
In some people, alcohol can also worsen snoring and breathing problems.
That can make nighttime blood pressure control even worse.
Janet thought her nightly wine was helping her. In reality, it was disrupting the second half of her sleep.
Habit number 2. Ignoring loud snoring, gasping, or mouth breathing. This is a big one.
And it gets missed all the time.
When breathing is repeatedly disturbed at night, oxygen levels can dip.
The body responds with stress signals that may raise blood pressure.
That is why some people wake up with morning headaches, dry mouth,
Foggy thinking, or unusual fatigue. They think they slept all night.
But their body was struggling the whole time. If you snore loudly, gasp, choke in sleep, or wake up unrefreshed, do not brush it off. This may need medical evaluation. This medical finding.
Habit number 3. Staying up too late and sleeping too little.
After 60, the body often becomes less tolerant of irregular sleep.
Late nights may hit harder than they used to. When sleep gets shorter and more broken.
Just one more minute.
The nervous system may stay more activated.
That means the body does not settle down the way it should overnight.
Poor sleep duration has been linked to worse blood pressure control
In many adults, and the effect can be stronger in older age.
Janet kept sleeping barely 5 hours, calling it good enough. But her body disagreed with that assessment.
Habit number 4. Scrolling, worrying, or watching upsetting content in bed.
The body cannot drift into calm sleep.
If the mind is still in battle mode,
This matters more than people think. Stress hormones do not care that you are under a blanket.
if your brain is activated, your body may stay activated too.
Late night worrying, doom scrolling, and emotional stimulation.
Can make it harder to fall into deep, restorative sleep. That can leave the body less able to reset overnight.
Sleep is not just unconscious time. It is recovery time. And stress steals it.
Let me say this clearly.
A lot of older adults are treating bedtime like their last stressful hour. Then they wonder why their body wakes up under pressure.
That is not bad luck. That is a pattern.
Habit number 5. Eating heavy, salty meals too close to bedtime.
This may sound like a food issue.
But it becomes a sleep issue very quickly. A heavy late meal can disturb sleep, worsen reflux, increase discomfort,
And make the night more restless.
And excess sodium may also contribute to fluid retention.
and higher blood pressure in some people. If you are waking up puffy, thirsty, uncomfortable, or restless, after dinner-heavy nights, pay attention. Your body may already be giving you clues.
For Janet, that pattern became obvious once she tracked it.
Her worst mornings often followed her worst evenings.
Keep alcohol light or avoid it at night. Aim for a more regular bedtime. Protect at least 7 hours for sleep, if you can. Keep the bedroom calmer. Less screen light, less upsetting content, less late-night stimulation. Try to eat dinner earlier and keep it lighter.
If late meals tend to disturb your sleep,
And if snoring or breathing pauses are part of the picture.
Morning light and daytime movement can also help improve sleep rhythm.
Simple habits matter. They really do.
Now let me give you the red flag warning.
Seek urgent medical care if nighttime symptoms come with chest pain.
Severe shortness of breath, fainting, weakness on one side, or trouble speaking.
Or a severe pounding headache. Do not explain those away as bad sleep.
And if your blood pressure is repeatedly high in the morning.
Or you have morning headaches, loud snoring, gasping, or unusual daytime sleepiness.
Please bring that up with your clinician soon. That pattern deserves attention.